You know, we've all been there. You get a paper cut, you scrape your knee. It's so common we just slap a bandage on it and forget about it. But have you ever stopped to think about what's actually going on under there? Your body is kicking off this incredible, super complex process of repair. It's pretty amazing, so let's get into what's really happening.
Okay, so here's what we're going to cover. First, we'll look at the step-by-step process your body uses to fix itself. It's called the healing cascade. Then, we'll talk about what can go wrong, the roadblocks. After that, we'll get into a super simple playbook for what you should do. And finally, we're going to tackle some of those big wound care debates. What's fact and what's fiction?
All right, part one. Let's meet the amazing repair crew that your body sends out the very second your skin gets broken. This whole coordinated effort is the healing cascade.
So first, what exactly are we talking about when we say wound? Well, for this explainer, we're focused on what are called acute wounds. These are your everyday scrapes and minor cuts, the kind your body is totally designed to heal in a very organized way, usually within about 3 weeks. Now, this whole healing process unfolds in 4 distinct phases. You can almost think of it like a 4-act play. It starts just minutes after you get hurt. But, and get this, that final act can actually last for up to a full year. A year!
So, Act 1. Hemostasis. This happens almost instantly. It's like an emergency alarm goes off, and these tiny cells in your blood called platelets rush to the scene. Their job is to clump together and form a clot, basically plugging the hole to stop the bleeding. It's your body's crucial first response.
Next up is the inflammatory phase. This can go on for a few days, and it's why a new cut looks red and feels a little swollen. Your body is sending in this specialized cleanup crew. They're there to fight off any germs that got in and to clear out any damaged cells. They're basically prepping the site for the rebuild.
And that brings us to Act 3, the construction phase, or the proliferative stage. For the next couple of weeks, your body is just busy. It's building new blood vessels and creating brand new tissue to literally pull the edges of the wound back together and close that gap.
And finally, we get to the last act, maturation. This is the long game, the final remodel. Over months, sometimes, like we said, up to a year, that new tissue gets stronger and stronger as all the fibers reorganize. This is the phase that ultimately decides what that healed skin and any scar is going to look like.
But, this amazing process doesn't always go perfectly. Sometimes it gets derailed. So let's look at the 2 most common villains that mess with healing: infection and, on the other end, excessive scarring. Okay, this is really important. You have to know the warning signs. Pretty much all wounds get some bacteria in them, but an infection is when those bacteria start to take over. So you need to watch for things like pain that gets worse instead of better, or the area feeling really warm. And for sure, any weird discharge or a bad smell is a major red flag that something's not right.
And of course, not all wounds are created equal. Some just have a higher risk of getting infected from the start. Like, if you get a cut and there's dirt or splinters in it you can't get out, that's a problem. The location matters too. Wounds on your lower legs can be tricky. And here's a key takeaway. If you have a deep cut that might need stitches, waiting more than 6 to 8 hours can seriously increase your risk for complications.
And it isn't just about the wound itself, right? Your own health plays a huge part. Things you might not even think about, like getting older or not eating well, can slow down that repair crew. And some things are really critical. Conditions like diabetes or habits like smoking can dramatically slow down healing and make an infection way more likely.
Now, scarring is a totally normal part of this process, but sometimes that construction crew just goes into overdrive and puts down way too much collagen. When that happens, you can get what are called keloid scars. These are raised, enlarged scars that can actually grow outside the original wound area, and they're more common in people with darker skin. So, knowing all that, how do you actually take control and give your body the absolute best chance to heal perfectly? Let's get right into the simple, science-backed playbook for taking care of a wound. This is how you become the hero of your own healing journey.
What's so great is how simple this is. It really comes down to just 3 steps. First, stop the bleeding. Just apply firm, direct pressure for about 10 minutes. Second, clean it out. And you do this just by rinsing it really well with plain old running tap water. And third, and this is a big one, cover it up. Keeping a wound moist with a dressing actually helps it heal faster and can even reduce scarring.
But listen, not every wound is a do-it-yourself project. There are definitely some red flags that mean it's time to let a professional take over. The most obvious one is if it won't stop bleeding after 10 or 15 minutes of solid pressure. But you also need to look at the wound itself. If it's deep enough that you can see fatty tissue or muscle, or if it's from any kind of bite, you need a doctor. Period.
All right, for our last part, let's have some fun and tackle some of the biggest myths out there about wound care. It's time to separate fact from fiction and figure out what really belongs in that first aid kit of yours.
Come on, you know exactly what I'm talking about. You pour that hydrogen peroxide on a cut, and you see that super satisfying fizz and bubble. It feels like it's just destroying all the germs, right? But is that fizz actually helping your body heal? Or could it be doing more harm than good?
Well, here's the surprising truth. When it comes to cleaning a simple cut, good old tap water is your best friend. It turns out that those harsh antiseptics, like hydrogen peroxide and rubbing alcohol, can actually be toxic to the brand new, delicate cells your body is trying to build. So that satisfying fizz, it might actually be slowing down your healing.
And here's another huge one. You know that tube of antibiotic ointment that's in everyone's medicine cabinet? Well, for a routine clean cut, it's actually not recommended for preventing infection. Just cleaning the wound well is way more important. Plus, overusing these ointments is contributing to the huge global problem of antibiotic resistance.
So what about some of the more natural remedies we hear about? Well, some studies suggest honey might help with very specific wounds, like certain burns. But the evidence for your average cut just isn't there yet. And for aloe vera, the science is still out. It's pretty inconclusive on whether it really helps these kinds of wounds heal any better.
So after going through all this, it really makes you think, doesn't it? It's worth taking a peek inside your own medicine cabinet and asking a simple question. Are the things you've been taught to trust for years actually getting in the way of your body's amazing, natural ability to heal itself? Something to think about next time you reach for that bandage.